Good morning and welcome to the show. My name is Koi. Now, in an effort to assess the cancer situation in Kenya, the Programs of Actions on Cancer Therapy, better known as PACT, has been set in place, and their mandate is to come up with a report that will assist Kenya to realize its goal of improving various services specific to controlling and eradicating cancer. PACT Kenya Cancer Assessment estimates that 50 people die every day from different forms of cancer, while 80,000 new diagnoses are done each year. Now, when you read or hear about such figures, you can only shake your head in dismay, given the fact that the country has limited facilities to diagnose and treat the disease. Today on Mid Morning Lifestyle, we get educated about the different gynecological cancers affecting us.
Breast cancer is defined as the category of cancer that forms around breast tissue. Breast cancer occurs mainly in women, but men can get it too. Many people do not realize that men have breast tissue, thus running the risk of the cells growing abnormally. A classic symptom of breast cancer is a lump felt in the breast or underarm. This method is, however, not the best because by the time the lump is big enough to be felt, the cancer has reached an advanced stage.
So this is a specimen of a breast cancer, and this is a slice of that whole breast. And I just wanted to show you, you can see the skin on the top, and that is the nipple right there, but it is ulcerated. So you can't really see the nipple because it's ulcerated, and all this is tumor that's come through. So this is very advanced cancer, and that's the problem in our country, that women come to us, to clinicians with very, very advanced breast cancer. So here you see this is all cancer. This, the whole breast has been replaced by this whitish tumor. This yellow bit is normal breast tissue. So very little normal breast tissue, but the whole breast is just cancer. It's just full of cancer.
It is for this reason that women are advised to go for medical routine screening known as mammography.
Ideally, we do 4 exposures, or rather 4 x-rays. We take 2 x-rays for each breast. That will be 2 views for each breast. The views we take, one is called craniocaudal, basically taking the breast from up to down, compressing it with this mammo table. We call it a mammomat. Okay, then we are able to compress the breast here, and once we do spread out the whole breast tissue, we take the x-ray. That will help us to pick even very small, like lumps or something like that, or maybe a calcification. Once we've taken this view, this is called craniocaudal, we'll take either for the right or the left, or left and right. Then we'll go and do a side exposure. Basically, we want to check the breast in 2 positions. We could have something maybe that we see on one position, and it could either be on our plate, on the machine. So we want everything that's shown on the breast to be seen in 2 views. So we'll ideally take 2 views. If need be, we can take a third view. But the basic thing is that we take 2 views for the breasts. We have digital processing. So we'll just feed it to our digitizer. The image will come out from the monitor, and we'll be able to either make a hard copy of the film, or we'll send it to PACS. Our doctors normally report the images on PACS, and then we give the films to the clients.
Carrying out an occasional self-breast exam, or BSE, helps in keeping up with changes in the breast. In case of any change, a decision can then be made on whether to discuss it with a healthcare provider. Breast self-examination is a screening method used in an attempt to detect early breast cancer.
What we emphasize on is self-awareness. Just know how your breasts look like, and at least how they feel like. You're not looking for cancer when you're checking yourself, either during a morning bath or during a shower. You're not looking for cancer. You're actually just getting to know, how do my breasts look like? How do they feel like? So that one day, if you find something unusual, something you don't like, you can say, hey, I don't like this. This is new, it has not been there. or I can feel something I haven't been feeling. So we encourage women to take charge of that, but we need to do that when they come to us, make sure they have a VIA or a pap smear, whichever is easier to do, VIA, and also check their breast because it's the same woman. And give her some education about cancer, what she needs to watch for. If she also needs to check her armpits, that she doesn't have swollen glands there, and if they are there, we hope they are not from the breast, they can be from many other things. So essentially, when she knows how they look like and how they feel like, with the day she will feel something unusual, she should also know that she can always come.
Cervical and ovarian cancers, also known as gynecological cancers, have in the recent past become a leading killer for women. Although cervical cancer is easily treatable, the key lies in early detection.
Cervical cancer is a disease that is easily preventable. It's a disease that we should be able to catch up very early. And in this day and time, really, we shouldn't have women dying of cervical cancer. In North America and in Europe, they hardly see any cervical cancer. Why? Because of very, very effective screening programs. It's one cancer where screening programs have practically brought their numbers almost to nil in Europe and North America. They still get occasional, but it's not as bad as we are. Every woman who has had their first sex intercourse, 3 years later, they should have a pap smear, whichever comes first. Sometimes, because our women are starting their sexual activity a bit earlier, then 3 years, whether they started at 16, 3 years later, they should at least have a pap smear, their first pap smear, and repeat that yearly.
Unlike cervical cancer, ovarian cancer is a quiet type of cancer that affects a woman's ovaries, and by the time the symptoms start to show, the cancer may have reached a very advanced stage.
When you look at things like ovarian cancer, unfortunately, we don't have mass screening modality for ovarian cancer as we do for cervical cancer, because it's one of those cancers, by the time you find it, probably it's been sitting there for a long time, or maybe someone is being treated for different things, or maybe they were not having dramatic symptoms. Unfortunately for most cancers, again, pain is not the predominant feature. So, but what we encourage is when they find something unusual, they're not feeling okay, that maybe they're feeling, oh, am I adding too much weight? Do I have fluid in the tummy? Do I have all these symptoms, that something that I'm not quite myself? I need to go and get checked. And if maybe you are told, no, you are fine, you're just worried, get a second opinion.
Although a lot still remains to be done to win the fight against cancer, taking charge of your body is always the first and most important step.
Look at you, Private Hottie.
Please, where's Ashley?
Oh my gosh, I'm so sorry.
Finally. Oh, I just got here a minute ago.
Don't tell her that. We've got to milk the guilt.
Unless, of course, you've got a good reason for being late.
A good hot reason.
Girl, you all right?
Yeah, I'm fine. I just came from the doctor.
Is everything okay?
Yeah,
What?
nothing.
Seriously, Ash, what is it? Okay, you're scaring us.
No, it's not that. It's embarrassing.
Come on, it's us.
I have HPV.
Oh my gosh! Wait, what's HPV?
It stands for the human papillomavirus.
The what?
That's why they call it HPV.
Is there anything they can do? I mean, you're not dying or anything, are you?
She's not dying. It's an STI, a sexually transmitted infection.
Oh, thank God. I mean, not thank God you have an STI, but, well,
How'd you know you had it?
I had a problem down there. Oh, come on, it's too humiliating.
Oh, honey, remember when you made me laugh so hard I peed myself? That was humiliating. This is your health. There's nothing to be ashamed of.
Okay, fine. I had bumps. They're actually called warts. It's a common symptom.
Who'd you get it from?
I'm not sure.
Okay, that's a little trampy.
I'm not sure because the virus can remain in your body for a long period of time before any symptoms appear, if any appear at all.
You know, they have a vaccine to prevent HPV.
Well, yeah, I do now. But how'd you know?
Because I got it.
You had this HPV too?
No, I got vaccinated. Did you know that at least 50% of all sexually active people will get HPV at some point in their life? And for women, the percentage is as high as 80%.
Wait, 80%?
Yeah, and sure, warts might be embarrassing. But more serious is that HPV is the leading cause of cervical cancer. You know, our bodies fight off the infection, but in some cases, the HPV virus can lead to other symptoms and most seriously, cervical cancer. The good news is the vaccine is really effective. That's why I got vaccinated. It's easy, just a series of 3 shots. Oh, I'm sorry guys, but I gotta get to class.
Oh, yeah, I need to go too.
But I don't get it. You and Christopher have been together for like forever, and you guys don't mess around with anybody else.
It doesn't matter. Just like Ashley, you might be infected with HPV and not even know it. Same with Christopher. That's why it's going to infect so many people.
Unless you get vaccinated, which I wish I had.
Why didn't you?
I didn't know about it, and actually, even if I had, I probably would have thought I was too busy or felt awkward about asking my doctor.
More awkward than today?
Men and women have different physiological and psychological responses to conflict. Many times, those differences make cross-gender communication difficult. Women often don't understand what men are saying and think they're being insensitive. Men, on the other hand, don't often understand what women are saying and think they're too emotional. Men and women have very different ways of arguing. So, in a better effort to help couples understand each other, Victor and Sarah Kabudha take us through the thought process of both genders during an argument. That's coming up next on Ties That Bind.
We'd like to thank you viewers for sending in your questions for us, and we'd like to handle one of the questions here from a husband who says, when we are having a disagreement, I like to have some space to process, but my wife wants to talk right then and there, which often causes more conflict. How can we resolve this?
With this question, the way that it's phrased, and it's about the temperaments. You know, some of us are extroverted. It's like we talk and then we think about what came out later. And then there are those who like to think through what they're going to say because they choose their words very carefully. And so I think it's important to understand that we have different makeups. Again, men and women already, that's a difference, just being male and female. But the second difference is that some of us under pressure, we will withdraw because we're analyzing what happened and what can I do differently. But others, when the same pressure is applied on them, they explode, they come out fighting. And the idea here that one wants to resolve it and talk right there and there. The other one actually wants, the other spouse wants to actually take time and ask the question. Sometimes it's asking questions about what happened wrong, what went wrong, but it also could be taking time for the temperature to calm down. And so I don't think it's something where we should do the whole thing of, take off the gloves and pick up a stool and throw something, because then that doesn't also help the temperatures calm down. I think it helps to take space sometimes in a conflict to process what has happened. And it takes patience then for the one who's very extroverted to take a minute and think through. I think there are those who they want to say everything while it's fresh in their minds, and the opposite one to take time and make things right.
I think I can answer this from personal experience because we can relate. We operate the same way. Yeah. I want to talk right now and resolve it now so we can move on. And Victor tends to want to have some space to go and process. Yeah. And I think we've learned over the years, I can say for me, I have learned that there is a value in having some time, not indefinite amount of time for weeks and months, but some time to go and think about it. Because I think that I know what I want to say, but then actually when I give him some space and I also start thinking about it, I realize probably, okay, I think maybe I'm not I have some fault of my own, and when we come back together, I'm a little bit more humble maybe and able to think more clearly. And I've also learned that when I give my husband the space he needs, he is generally the one who will come back and be the one to say, okay, now we can talk. Probably he'll even say, I want to apologize for this and that, what happened, and we can be able to resolve it much easier. So I would say, take time to learn each other's personalities. Are you one who talks before you think, or are you one who takes time to process and learn to appreciate both? One of the reasons that I think we've been able to work better over the years is because we both have given. I've learned to give him the space, but I think he's also learned sometimes that we stay and talk it out. And so it's important to not just be so defensive all the time, but try to see it from the other person's perspective. Try to see the value in how the other person is doing something. And I guarantee you become a better person yourself when you learn. That's one of the reasons why it works when you don't have to marry somebody who is the same personality. It can be a conflict when you're different personalities, but it can also be a great complement to each other. And I think it's a mechanism that God instilled in us to help us learn a different way. Victor is very strong. He can be very outspoken, and I can be very, I love to keep the peace. I don't like conflict. And again, we've learned over the years that I have learned to become more firm when I need to. I don't allow people to step all over me all the time. But also, Victor, I've seen him many times now be softer, and more calm in the way that he deals with people. And it's not necessarily something we did consciously, said, I'm going to become more firm. But we have influenced each other, I think, in a positive way by understanding the differences.
As a woman, I cannot stress how important it is for you to get routine checks with your gynecologist. That one trip can save your life. Spread the word to your friends, your family, and colleagues, and this applies to men as well. Remember that cancer affects both men and women. Send us your comments to midmorning@standardmedia.co.ke, or better yet, go to our Facebook page, KTN Mid Morning, like it, and drop in a comment. We would love to hear from you. That's all we have for you today. Do enjoy the rest of your day.